time to take a leadership role. That was the wrong one, right? Everything else is right. Asking difficult assignments, that's what you guys understand that?
Yeah.
Any question on that question?
No.
You may see this again on the final exam.
Can we get to the one that everybody got, like majority got wrong?
You want to start there?
That's how we usually do it.
Actually,
Hold on a second. I know how to do. I want to get my way. 1 second. Why are you so hyper? Any questions on the leadership? Any questions on the leadership potential? Because I may change the word and say. I may change the word and say, except all of the following are true. And then you may understand. Any questions on that concept? Okay, mine is pretty self-explanatory. I don't know why y'all missing something. Let's see what else y'all missed.
So 9% got it right?
90% of that one got correct. No, look at number 5. Only 37% got that one.
Okay, let's talk about it.
1 second. Which of the following? I didn't write this question. So cultural variable, y'all, who did that? Who's cultural variable?
Could have been Moultrie. But that's why we asked for an area of concentration.
I don't know what her area of concentration is. I know what mine is. So I'm gonna go with my questions.
Oh, y'all don't talk together?
Yeah, she said you were gonna be in class today.
Just to go with my
Wednesday exam.
Yeah, I can go over my questions. That's easy. I didn't write the other part. Okay, y'all follow me? So at least y'all get my portion correct. I'm trying to get it out.
Is there a possibility to act like the other?
I just want to make sure y'all understand. My portion is okay, y'all good? As long as y'all get my 20 questions right, that'll boost your grade up.
How many questions?
Well, you had 20.
I don't know about this. I don't know about that one.
The wrong question. It says how many people were here for the
Too much talk. Come on, all right, let's come on down here. Let me get you right here. Let me get you right here. Miss Alexa, let me get you right here.
I'm okay.
No, I understand. Don't get kicked out of the class because you want to be. Let's just come right here. It's a lot of chat. I'm trying to. Every time I look up, y'all laugh. Yes, ma'am.
So my question is, every time somebody asks a question, you say 1 minute.
Yeah, but if y'all ask a question, I don't have an answer. Yeah. Okay.
So if we raise our hand and you call on us, then we can ask.
Of course, that's true.
That was my question.
Oh, of course. Yeah. I don't have it. Y'all are asking me questions. What does she think about her? I don't have that answer. I don't know about her area of concentration. I'm not trying to help y'all with my portion. Here's another question. Everybody missed this number 8. This may come back up. Which of the following statements are true regarding breakthrough innovations? Who did that? Who taught that? Who taught that?
That sounds like
Oh,
cops.
that man.
Do y'all know the answer to that? Y'all know?
No.
Okay, so I guess it was a A, B, C, D, E, and it said select all that apply. So in this one, he said they're typically more difficult to manage through given structured process. They're often broad in scope, and they can impact an entire organization. Okay, so that's 3 of those. So don't miss that again if it comes back to the final exam, which I'm writing. Alright, so y'all got those 3? Any questions? Everybody missed it. 45% of the class. Alright, good enough. Okay, here's another one, number 13. Which of the following work conditions creates a sense of belonging in Maslow's hierarchy needs? Y'all know that one?
Oh yeah.
Y'all missed that. It says creating a strong team environment was the answer for that one. I don't know who wrote that question. Creating a strong team environment. So y'all wrote that down. And then here's only 2% of people got this question right. Only 2%.
That's not alarming.
Only 2% of the question got this one right. We're gonna listen. We're not gonna talk. We're gonna listen. We're gonna listen. Which of the following should be employed regarding the MTM pharmacist referral form to improve the bi-directional referral process? Select all that apply. Who talked about that?
Davies.
No, that was Davis.
Dr. Davis taught that.
Here we go. Here's the answer. Because 2%, only like 1, 2 people got this one right. Select all apply is A, B, C, D. It's only the first 2. Give form to the patient and share with provider and outline services that the pharmacist can provide through the MTM service. include a primary literature resource consultant for each disease state, MTM. And then it says include multiple quality metrics, data focused on and examples of documentation systems during the MTM, whatever that was.
What, so that question is not selected on our phone?
It is, so
It
the
was,
first two.
so
A
the
and B.
first two.
Any question on that? Hope y'all are listening. Yes.
What was the second?
The second was outline services that the pharmacist can provide through the MTM service. Okay. Any questions on that? Everybody got that one? Number 16. Here's another one. Bi-directional referral process. Which of the following should be employed? Same thing. It's literally the same question.
Right.
It came twice. You got it wrong twice.
So it's A and B. So y'all, A and B, y'all got that one?
So we get free 2 points.
1 second. Y'all got that one? I didn't write it.
Yeah.
That's 4 points.
Should be given to us.
Number 18. In today's healthcare environment, payers are focused on value. Which of the following is an example of a quality metric that may be used as a basis for payment? Select the best answer. So it was patient fall risk, blood pressure, neurological status, and OTC supplement.
Blood pressure, they say.
Blood pressure. Okay. You guys missed that one. Any questions on that? I can bring back. A lot of people missed number 26.
What was this question said in this class?
I don't even know. I never heard that.
Never heard this
You
thing.
never
This,
heard of that?
No.
Which one did you not hear?
this
The
blood
blood
pressure something.
You didn't say that in this.
I've never heard it in this
Is it
class.
in the notes?
That's all I was saying.
Yeah, is that Dr. Cox?
I don't know. I don't have that.
I don't know where that question come from.
Or
No.
could it be Moultrie's question?
I don't know. Could it be in the notes? I'm
That's
It's
why
not.
having a group. What's wrong with me giving a solution? What's wrong with that? What's wrong with that?
Ain't that wrong?
What's wrong with that? What's wrong? Talk to me.
No, you're supposed to be on the side of you.
Who's that about? What do you mean? I'm not. If we have a problem, I'm the leader. What's wrong with me coming and saying, "Hey, this is what we're gonna do"? What's wrong with that?
Ain't that wrong?
What's wrong with that?
So what she's saying is.
No, this is me. This is my question. Yes.
But what she's trying to explain is because you weren't involved in the problem, so if me and her have the problem, it's better for us to come up with a solution because we know what the actual issue is.
No.
They clearly don't know the solution. They have a problem.
That's not true. That's a good one, but no, that's not true. The reason why the leader should never come with the answer, sometimes, seldomly, right, is because you don't build any type of teamwork. You don't build any type of rapport with your team. You should ask them, hey, what do you see as a solution? If they commit to saying, hey, this is what I think they're gonna do, they're gonna be more likely to follow that. If I say, hey, this is what you're gonna do, they're gonna be like, I don't even wanna do that. This is reality. This is reality, I'm trying to tell you. In my team right now, listen, then we had a discussion about this, 1 second. If I go all the time, if I have an issue with my team, how do you think we're gonna get these results? If I used to be like, hey, this is what we're gonna do, you think people did that?
Yeah.
Yeah, because I coerced them. I coerced them to do it. If you don't do it, or else. But when they came to me and said, hey, Jason, I think this is the best way to do it, I said, hey, man, go try it. And they felt better. They felt that's the way you build. What's the question? What was the question? How do you do what? More inclusive environment. That's how you do that.
Excuse me, sir.
Yeah. She had one question. Let me go to this. This is Kiana.
So the answer choice that you had was to focus on the solution, right?
Yeah.
So,
You never focus on the solution.
wait, I have a question.
Yes, ma'am.
So, saying focus on the solution and saying the leader come up with the solution, I feel like it's two different things.
Regardless of that, I agree. But that's not what I'm trying to say in this answer choice.
But when you have a workplace issue, why wouldn't you focus on the solution?
You focus on
That
the.
was my thought process.
Okay, I got it. Y'all want me to go to opposite?
All of us thought of it.
No problem. Y'all want me to go to this question?
Yes.
It's not about that, it's just to give us the point.
No problem. Do y'all understand what he's saying on the exam? I'm not the same. Best answer?
But
Don't
no,
focus on the solution. In reality, you don't focus on the solution. You focus on, hey, how do I build my team up right now? And my team comes with the solution.
So they
Well, what do you
should
feel
come.
about
Okay.
how we feel like? We
No,
really feel
I
like.
need the answer.
No, yeah, like even if you give it to us to throw it away,
That's
but
a
in
fact.
reality, some of us really think about coming up with a
Let me
solution.
tell you something. As a leader, never come to your team with the answer. Don't ever do that. You come, hey, let's talk about it. How can we best come up with a solution? That's how you're gonna grow the team. That's how they're gonna feel included. That's how they're gonna drive those results. I guarantee you. It's reality. Try it. Try thing you don't do when you're hiring, when you're trying to hire somebody. Talk about it in class.
So this is the slides for successful recruitment.
Don't worry about the slides. Just listen. I'm not a slide type of guy. I'm a student. Just listen. That's why I said, come in class. What did I say? What did I say? The worst thing you can do when you're hiring somebody.
Rush.
Kind of. Why?
Look at face.
You're just guessing now. What did I say? I said the biggest thing. Anybody remember?
Look at face.
Thank you, boy. Don't ever hire out of desperation. Good. That's one of the answers. You don't see that.
It's select all the time.
You don't see that.
Can I get extra point for that?
When you talk about when you talk about hiring needs, right? What you should do? You see, I'm gonna ask this. I think you just said it. So just rush it. Just never rush when you know. That's a good way to answer that. Never rush. Job descriptions are vital because of what? What does it look into? Does it look at recruitment? Does that help? When you have a job description, does that help?
What?
If I post my job description, I'm looking for this type of person, will that help like a recruiter?
Yeah.
A little bit, it's a guide.
Will it also help in compensation? It'll tell you how much you cost?
No, because sometimes they don't.
Yeah.
But it does help.
Okay.
But not everybody's
Yes, it
What
would.
about training requirements? Does it kind of say, hey, you
Yes.
Yes.
Okay, good. Peers and you know, you want to have other peers involved in the interview process. Why?
Yeah, because so that the one that is can work with those is working
There
with
was
the
so
people.
many channels. Which one are we going with?
It's work. That's the people you will be.
You don't have to record me. I know I'm smooth. All right, here we go.
Dr. Monroe, what was it? I don't, this one murmured, this one murmured. Which one?
I said it's important, or is it important to have a peer involved in the hiring process?
Oh, is it yes or no? Oh.
Is that a true or false question?
I'm asking. What do you think? Is it important?
Yes, it is important.
Okay.
Some common ways, areas to source. We talked about that. What was like not one to source somebody, to look for somebody like a candidate?
You can.
We talked about it in class.
Yes, sir.
Just where do we go to look? Where do we say, hey, this maybe not good, be good?
Instagram.
We said that, right?
Oh, yeah.
Okay, what else do we say? What's the best one you think?
LinkedIn.
LinkedIn. Good. Which question is frowned upon when we talked about the interview? Which one was like you're not asking?
Age,
What else? What was
gender.
One? Which one I said like you're not asking this question?
Sexuality,
Okay. What else? One more.
Race,
Race. What else?
sexual preference.
age,
Kids. Yep. One more. One more. Keep going.
Not pregnant.
Think.
religion,
Race.
Got race. What else? One more.
religion,
Transgender.
Religion. Good.
You saying transgender?
Good.
Age, race.
Wait, no, they did ask.
Can you ask them if they're a
They
vegan?
Question you cannot ask.
Why not?
Huh?
You don't
Okay,
care.
that's none of your business. That, well, no, you can do it in mild conversation, but you can't make sure that it's part of the
Can
criteria.
that be looked at as discriminatory? When
Which
ask
one?
somebody if there's a vegan?
No.
No, but it's just,
If you were
what
ordering
you're essentially
food,
saying is, if I ask you if you're a vegan, and I'm not, and I choose not to hire you because you're a vegan,
Because we
That
look
is
like you like we
discriminatory. That's what
slaughter
you're
animals.
saying.
If I have a meat, if I'm hiring for the meat department,
that's discriminatory.
and I ask somebody, if I'm hiring for the meat department, I ask somebody if they're vegan, is that discriminatory?
Yes.
yes.
I'm just making sure. You said it wasn't 2 seconds ago. One of y'all said it wasn't. see how it is. Here we go. When discussing compensation, I had a whole thing about compensation in class. Somebody asked a question about compensation. When is the best time to ask about raises? And Nick asked it actually. When's the best time?
To ask about what?
Like if you want to talk about his compensation, I want to go back.
After a year.
Being interviewed?
Is it, I don't know.
But there's a tactic on how you.
What did I say? What did I say?
What, during the time you're being evaluated?
What did I say? What did I say?
The quarterly thingy.
I said that.
That's what I just.
After a year.
His question was, how do I, negotiate my pay? That's what he put.
But that didn't
Oh,
sound
is
like
it
what
during
you
the
just
hiring?
asked. That's not what you just asked.
That was
Anytime.
Okay, how do you negotiate pay? Like after,
The best time to ask.
during the hiring process.
During the hiring process.
y'all don't remember the question again?
We remember we had a discussion.
I said something very specific.
It says,
Pay?
it's never, like, ask them how much they're willing to pay. Near the end, after you get your offer.
Always
Discuss about
negotiate.
that.
Always negotiate.
Negotiate.
It's never a bad time. Always negotiate.
Oh, okay. So anytime.
Anytime. I told him. I said, hey, call. You should go back and forth. If you feel like you work more money, you should ask. Okay. You don't have to say, hey, this is where I'm working. Here's what I come. Hey, if you've been a pharmacist, hey, I want $60 an hour. We only pay 50.
So say for instance you like 8 months in and you want more money, you can still
I would
ask.
say before.
Yeah, you asked before.
But I would say you can't ask
Before you
anytime.
hire.
Always
Walk
negotiate.
in the office.
Yeah. You can
Because
always
they
negotiate.
come on them and be like, what, you want more money? They're gonna start staring at you.
But we ain't asking. That ain't on the question. We just talking.
But I'm just saying, if you educate people, just keep it 100 and let them know that there's a tactic. Because if you already
It's
have
not really a tactic. If you feel like you're worth $100 million, prove it.
that's all.
Just prove it. I pay $100 million if I'm gonna get the best. You did. Questions there? Training. It's important to train because they can train new colleagues because of what? Why is it important?
So they know how to
You know what?
run,
The
operate.
job entails, right?
Right.
The guidelines and everything. You talked about that, right? And then they're able to gain the proper skills and qualifications. All right, good. Primary research. We talked about that, right?
Was that on the other?
Nope, it wasn't on.
It was on
Original
MTN.
work.
It could have been. But what's primary research?
The original work of the.
Okay, so y'all can be able to sift through that, right? That's pretty easy.
Examples.
Is medication profile reviews primary? Do y'all know what primary is?
Yeah.
Okay, so what is
But
primary?
in terms of like what they call it,
It's a slide that I went verbatim on. Just repeat that slide. It's a slide. Yeah. And then know the difference between secondary research. Yeah. That's a slide. And then I put on some ones that we already had. What is SWOT? What is the acronym SWOT stand for?
strength,
Self-
weakness.
So you'll be able to know what's involved. And then there's some. What is the vision of an organization? What does that look like?
Is a why?
They kept talking about.
What does the vision look at?
Vision looks at the value,
What does the vision look at for an organization?
the value.
What does the vision look for the?
Like where is it heading?
No, what's the vision of an organization? What is
Can
it?
you give us options? So we know
The vision describes the purpose.
Yes. Like the trajectory.
Good job. Know the difference. So know the difference between the vision and the mission statement. It's a slide. It's pretty easy. The mission statement does the purpose. The vision does what?
Trajectory.
The value.
Defines what the program wants to
Or the value.
That's right. Define the program.
Okay.
Yeah.
What'd you say?
Wait, what?
Defines what the program wants to achieve.
Like trajectory, like.
Documentation. I said it's vital because what? We talked about
Accountability.
it. I said one thing. I said if it doesn't get documented, it doesn't.
It doesn't exist.
Y'all remember I said that?
Yes.
Okay, good. And then, you gotta have a plan because it's important. Y'all understand the reason why I plan. Does upper management need to get involved if you have a plan?
No,
Yeah, right?
if you have to.
Yeah.
It should, so it does never alleviates the need. Should a new leader look at the mission statement?
Yes.
And then I added another one, we talked about professionalism, that's easy.
Right.
And, important factors, innovative products, I just added another one. Foods is not one of those. Alright, any questions on mine? That's
Say that like
that was what Alexis said. It says all the following are important factors when innovating products.
Put it on the city exam.
Absolutely.
It's like a build up.
Any questions? Mine is easy, yeah.
All the following are important factors of, I just forgot what you said.
Innovating products.
Innovative.
You want me to read the answer choices too?
Yeah.
Yeah, that would be, that's how Dr. Mo's, you know.
No, Dr. Mo does. But Dr. Mo be, as soon as that exam comes, flip. Any questions? That's 20 questions. You should get over 40 or 50 just by doing that.
We still failing if we get
So my questions are pretty easy, right? I'm not trying to fail y'all, because some of this stuff, the slides, you're not gonna remember as soon as you leave it. So I'm not really testing your ability to memorize 100 slides. I'm testing your ability to come to class and let's talk about it. Okay? Let's rock and roll for today.
We're done, right?
Today's class is on the next end, the final, right?
Let's talk about third-party prescription medication. Give me about 10 minutes. And then,
Are you going to the restroom too?
No, we'll continue. I'm gonna take it. Sorry, I didn't mean to that loud. Sorry, I was in the front row. I'm so sorry. Yeah, I'm gonna be
Oh, there you go.
We got headaches from earlier.
Yeah.
It was overwhelming. I'm telling you, it was really bad.
Bro, when your grade is on the low,
No, I'm telling you.
you remember, you know.
It was
I'm still the professor, even though I'm smooth and cool, I'm still a professor. That's disrespectful. Hold on a second. Party.
I just like school.
Oh, she did both the times?
That's it.
I didn't read it.
We can post it later.
Let me send it
So
to
we
you.
needed
So how does the whole thing go? Like, so the manufacturer has the drug, so this, you might have to touch this. So this costs $2 to make, right? Then what happens? Okay, so the price is $10, and they say 2 cents to make, $10, and who they sell it to?
The customer, the
Sell it to
patient.
pharmacy. So the retail, the CVS's, some of the, then what happens? How does the insurance get involved? We sell it to the consumer, but the consumer may have insurance. So what is insurance?
It's a third party.
Third party what? What is insurance?
They pay
But third party
a
coverage.
percentage.
What is insurance? That's not what, you asked to tell me what is insurance? What is insurance? What is insurance? What is that? Why are we paying insurance? Why is it important to have insurance?
Liability.
What do you mean you can get stuff taken care of? Why can't I just pay it out of cash?
Method is just a thousand of my own, but some places you're not gonna get taken care of.
What do you mean? What is insurance? Give me somebody in the back. Why is it important? Mondo, what's insurance? You got 100 on the exam. What's insurance?
Really, Armando?
What's insurance?
Y'all do know he said that.
Why do we need insurance? Why is it important for insurance? I can't hear you. I didn't hear you. So it's, thank you. That's the right answer. So there.
What did he say?
All right, y'all can go ahead and go.
It wasn't that,
It's
she was
okay.
asking me
It's
a
okay.
question, I was
I know.
trying to send it to her.
Go ahead. I don't want to listen. Y'all talk. But for the consumer, it could be CVS. The consumer, it could be $3,000, just based on whatever they feel like has happened, right? And so our insurance then does what? It has like a copay. We're paying $100 a month. Then it's a copay, right? What's a copay?
Patient responsibility.
Patient responsibility, right? So they say, hey, just because you paid this, we'll pay this, and that kind of helps. That's it. this is what we're talking about today, and how that works and how we got to that, okay? Just that basic fundamental. Any questions there? All right, let's jump in. So we talked about this TPPS, right? This third party, payers. It's the majority of payments for pharmaceutical products and services comes from third party payers. Determination of payment amounts is important for payers, patients, and retail pharmacies. You guys know what a retail pharmacy is, right? It's a licensed entity that delivers pharmaceutical goods. And again, it's TPPS is entities that reimburse retail pharmacies. So the impact, patients' access to expenditures for prescriptions. We talked about the expense. It's very expensive. If you looked at some of the costs for drugs, it's expensive. It's expensive. If you don't have insurance, you don't have the access to that care. So the insurance is vital, right? Reimbursements, this impact, it talks about reimbursements for prescriptions and services for pharmacists, pharmacies, financial indicators, and it could be public or private. Give me an example of a public insurance or third-party payer. Give me an example. Give me an example. You talked about it. Public. Medicaid and Medicare. Good job. What's a private? Give me an example of a couple of privates. Humana, Blue Cross Blue Shield. Aetna. Good job. Who owns Aetna for one bonus point?
Yes. One.
Alright, private third-party payer. We just talked about it, right? So privately owned, pharmacy benefits, managers, health insurance companies. They manage and administer prescription drug benefits for insurers and other plan sponsors. They're contracted through retail pharmacies. They have formulary developments and managements, utilization, cost management, claims processes, and payer management. Okay? Public, we just talked about it. Medicare, Medicaid, state and local programs from low-income enrollees. We went over Medicare and Medicaid, etc. So, Medicare and Medicaid is for uninsured, right? So you see that question on the exam, you guys will be able to answer that. Uninsured, right? Yes?
Medicaid, Medicare?
Yeah, uninsured.
Uninsured.
Oh,
No.
so low income.
Low income.
Low income. Low income. And 65 or older when you're not with. Here we go. Looking at this. It seems very complicated, but all it says is, and I just went over it, pharmaceutical manufacturers, they sell it to community pharmacists, which then sell it to patients. But before that, the community pharmacy runs the claim through the PBM, right? Which then, you can have a mail order, or you can, the PBM will send back the copay for the pharmacist or for the patient, and then they'll be able to do that. Okay? Super easy. Any questions? It's very basic. I'm not trying to get to depth. Medication supply in the retail sector. So for primary supply chain for prescriptions is manufacturers, wholesaler, retail, mail service pharmacies, PBMs, and plan sponsors. Give me an example of a warehouse, a pharmacy warehouse that
Amerisource.
Amerisource. Yeah, what else? McKesson. Yep. Cardinal. Good job. All right, good. So if you see a question on the exam, give me an example of a wholesaler you'll be able to answer that. All right, medications. The process. So, dispensing a third-party prescriptions involved a number of steps. So, prescription order, right? And the patient comes with their insurance card. You verify that, enter it to the computer. The prescription order is prompt. We get the medication ready. Then we send the claim right to the payer, whatever the case is. The message comes back from the payer, hey, this month, medication costs, $2. We're going to sell it to the patient for $10. Here's the copay, whatever the case is. Transfer medication, to patient with counseling, and then collect patient's portion of pay. You guys know all this. Third-party prescriptions generally cost more to dispense than private pay prescriptions, right? Due to extra steps involved in the process. It takes 20% of the pharmacy's, personnel time. Okay. You guys understand that? You guys know? Why is that? Third-party prescriptions generally cost more to dispense than private pay. Why is it?
Due to retail markup.
Could be, yep, the reimbursement pressure that, you know, yeah.
Right.
What else, any other trains of thought?
Because of manpower, like when the employee filing process.
Not really. Yep.
That requires more paperwork.
Could be. New computers and different things.
Public TV.
That's right, yeah. Yeah. Why do you guys think it's more like Medicaid and Medicare? Why is that?
Oh, premium pay. I'm talking about premium pay, right? You're talking about
More regulated, right, through the state and federal government, right? So there's a lot of different things that have to go through to get the Medicaid. But their copay is zero to what? Zero, right? It's like, man, can I be on Medicaid sometimes? You know, they get everything free. But it's for uninsured?
No.
Low income. Alright. And we talked about that dispensing process for patients with prescription covers, you know, involved activity. We just talked about that whole step process where you have to do the, you know, that. Pharmacy contracts, pharmacy payment based on formula for dispensing prescription. So payment is equal to the ingredient cost, right? We talked about this. How much did this cost to make? 2 cents. And then we talked about dispensing fee. I'm gonna tag it on. It could be $22,000. It don't matter. Whatever I want to do. So it's, you know, ingredient cost is the cost of the drug, and dispensing fee is the cost of dispensing the RX. What also has a dispensing fee? What type of person has a dispensing fee? The pharmacist. So CVS, every script, we get something that kicks back to the pharmacist. You
how
guys
many
do
percent
that?
is it, you know?
Huh?
How many percent?
I don't know. But it does get kicked back to the actual dispensing. Contracts, you know, usually state the reimbursement fee for the prescription, you know, is the lower of two prices. So this price from the reimbursement rate formula, I don't think I should test you on the reimbursement rate. Just know there's a reimbursement rate. Okay. Ingredient costs, very important. Okay. There's a concept with this, you know, this actual acquisition cost. So it's the price that the pharmacy pays to purchase the drug. So for example, if CVS says, hey, this costs 2 cents, you know, we're gonna buy, you know, 100,000 of them, we may get it for 1 cent. So that's the acquisition cost. It varies across pharmacies. You know, estimated ingredient cost, whatever it costs to make that, and then average wholesale price. What is that? What is the average wholesale price? What is that?
Price we sell it for.
So price we sell it for, but in bulk, right? So if I'm buying, you know, 100,000 of them, there may be a different cost for me to buy, you know, 5 of these. Does that make sense? This is pretty easy, right? You guys will get 100 on my portion of this. Is it? Maximum allowable cost. So this is the maximum amount per unit, you know, medication that the third party will pay. So for an example, you see stuff like Ozempic. Anybody know what Ozempic is? What is that? It's a mechanism of action of Ozempic. Give me the one bonus point.
SGLT.
What is it? A glip. What is a glip?
It's a GLP.
That's a
It's a
GLP.
What is it?
It does a few things.
Like what?
So,
Does it help insulin get into the cell?
yeah.
What is a GLP?
Glucose.
That's sad. That's sad. Are you talking about the graduate?
Damn.
You think you gonna learn stuff in Q4? This is it. You only got like what, another month and y'all out? Alright, let's focus on those.
I know it deals with the gut.
What is it?
I know it deals with the gut because that's how it helps
So how
suppress
does it
the
work?
appetite.
So how does it work?
It's like, isn't it something with ghrelin or something?
Ghrelin?
Yeah, that's the enzyme that helps with
It's
the
an enzyme?
appetite. Whatever. Come on, ghrelin.
Not with appetite.
Yeah.
How does it help with the appetite? I thought that was another.
Reduce the appetite.
To go to the brain?
No.
Somebody has an answer for you.
Yes. Linda's gonna save us.
Go ahead.
So it's reduces blood glucose by stimulating insulin secretion.
How does it stimulate insulin secretion? How does it help stimulate insulin secretion? Does it do something on the side of the pancreas or something that helps stimulate the secretion?
Yes, the pancreas.
That's sad. Ain't nobody looking it up either. Y'all
Yes, it says stimulating glucose-dependent insulin release from the pancreas,
How?
pancreatic insulin. That's what it says.
So that's what it does?
And it said also known as slow gastric emptying. Mhm.
Alright, so we talked about the average manufacturer, we talked about the maximum allowable, so that means the insurance may only cover, if this costs $10, they may only cover $5 based on that, and that may be your copay is the rest of the $5. The average manufacturer's price is the average price paid for the wholesalers to manufacture the drugs, right? So all these acronyms, do not spending time on that. The only one I want you to know is AWP. What is AWP?
Average wholesale price.
What is that?
What we pay for it in
How
bulk.
much you pay?
Okay. Any questions on that? Any questions on that? Why do pharmacies care about the average wholesale price?
So they know how much they can make it, yeah.
Okay. That's the only one we care about is the average wholesale price. If we can get it in bulk and we can sell it at a rate and pay our pharmacists, then we'll be profitable. And we do that, by 3,000 medications, and that's how we make it. Okay? I don't want you to know about the whack. Don't worry about anything else with that. Dispensing fees. Here we go. This is conceptually represents the payment for professional services. We talked about the kickback that CVS gets for dispensing any medication, right? So it's usually a fixed amount. It's lower than the actual cost of dispensing the actual drug. It should be sufficient to cover services and operational costs plus profit. Okay, so services are operational costs, the salaries, rent, utilities, operational expenses unique to third-party prescriptions. So it generally ranges between $2 to $3 for brand names and $3 to $3.50 for generics. Why do we get more money to dispense generics on the retail side? Why? Why does it sell the most? Cheaper what? Cheaper what? Cheaper
than generic?
How is it cheaper than generic? Why? Okay, so why are we charging so much for it?
Because that's the one you're gonna make profit on.
How are we gonna make profit on the generic versus the brand?
Because you don't do.
No.
On generic, you don't do.
What?
It's just cheaper cost.
You
Cheaper
don't do
to make. Slow down. This is the concept. So it's cheaper to make a generic, right? So you buy the generic for 1 penny, right? And you're selling it for how much?
Remove that bottle there.
Right? Brand name you buy. Okay. Brand name you're buying it for how much? You're gonna buy it for $20, and then you're gonna try to get some type of reimbursement in that, but it's tight with a brand name. Generics, you have a wide range. That's why we can charge more for dispensing generic, because we get more money back. That's the concept. You guys got it? That's the game, name of the game. So for CVS, for lisinopril, a box of lisinoprils with the specific expo manufacturer, we may have a contract that says, hey, we'll buy up all your lisinopril at $1. We'll buy it, $1 a pill. But we know we're going to sell it, for $10 a pill. So that balance, but brand name, we stuck. If we buy this specific expo, we don't have that pressure. That's the balance with retail pharmacies. That's why it's hard when we do a lot of brand names to make money. Anybody not understanding that? Who doesn't understand that concept? Yes, ma'am. Yep, no problem. So a generic drug, is that more expensive to buy, or let's use another example. I got another one. Skechers shoes. Everybody know what a Skechers is? Mm-hmm. Versus Jordans. Which one is more expensive, a Skechers or a Jordan?
Jordans.
Why are Jordans more expensive than Skechers?
The brand.
The name brand, right? Right? It doesn't have anything to do with the quality of the shoe.
No.
Once you ascertain that the shoe quality, would you ascertain that the shoe quality in a Jordan and a Skechers could be the same?
Could be.
Could be, right? So all we're paying for is what?
Name.
For a generic to be passed as generic, what does it have to go through?
FDA, right?
Everything that a brand name has to go through, actually. But it just loses its patent, so therefore we can make it again. So if it's on the market, it has the same capability to make the drug, or to get the drug effect versus that. So the two shoes, we can buy generics, or this Skechers, we can buy all of them in the world cheaper than we could buy Jordans. Jordans were going to be limited because it costs more. So when we reimburse, I can charge more to get a generic product because I paid less. And it's the same thing. Questions? That's the concept, that's it. What don't you understand, Latifah? Talk to me. It's okay. You're gonna go out in life and you're gonna think about the payer. This is the reason. CVS, this is how we make money. Generics. There's a report that comes out for CVS. Anybody that does not dispense the specific generic that we require them to do. Why? Because we already have contracts with the specific manufacturer for the generics. We gotta sell these because we get the most amount of money back. Okay? Any questions? Nobody taught me that when I graduated. This is management. When you get your own pharmacies, you're gonna try to get, what can I get at the cheapest rate and get the biggest kickback? Okay? You got Miss what's your name, ma'am? Sorry. Ma'am? What's your name again? You got it? So Jordan, same shoe, they both walk. But people pay a lot of money, I got all the Jordans. Pay a lot of money for the Jordan. And you can get the Skechers. Alright. Payment calculation example. Do you guys want a payment calculation example on the exam?
No.
Okay, great. Retail pharmacy reimbursement framework. We talked about it. So most third parties, pay retail pharmacies on a retrospective, right, fee for service basis. You guys understand that? Fee for service. You guys understand that? Okay. Pharmacy files a claim with the payer when dispensing the medication and rendering a service and collects sharing the amount from the patient. At some later point, the payer reimburses the pharmacy for prescriptions and services. That's fee for service. Later, retrospective, after we collect the money back from the insurance. There's some cases where we dispense the wrong quantity of medication that the auditor comes and says, hey, you dispensed the wrong one. I can't give you as much money as you submit. Okay? I'm hitting you hard now. This is everything. Okay? Almost done. That's all I want you to know. That's it. That's all I want you to know. You don't have to worry about none of that. That's it. Any questions? The concept. Any questions on the concept? That's it. That's what life is about.
Good job.
Any questions on the concept? The concept.
That's for service.
Fee for service. Yeah.
So you said, so the third party pays you, CVS.
Yeah, that's right. Hold on.
So the third party pays you, CVS. You dispense the medicine to the patient pay the copay. If you give them the right amount, whatever, everything is right, then the third party gives you some more money?
Yeah, the copay goes to us, but not really. The copay goes to us. So for an example, anybody have this market?
This one.
Alright, here we go. So lisinopril.
Here, copay.
Okay, this doesn't work. Lisinopril. What's the brand name? What's the brand name out of here? Then what's the chest? Okay, give me another brand name.
Zestress.
Alright. Hold on 1 second. I'm not done. The generic that we buy, and I'm going to make it up, is Monroe. Monroe brand. Okay. In Monroe brand, we pay for 1,000 count bottle. We're gonna pay $5 for 1,000 count bottle of generic medication. Monroe generic. Okay. The pharmacy for 30 pills, we're gonna charge $12 for 30 pills. In this $12, it has the pharmacy RX dispensing fee. It also has the manufacturer price that we paid. So this, it has a little bit of that. It has, it doesn't have a copay. Let's just keep it there for now, for simplistic sake. So it has a dispensing fee and manufacturer. The insurance says, hey, your insurance, you're at Aetna. You say, hey, for every generic you dispense, all you pay is $5. There's a $4 plan at Walmart, right? Y'all know that? They still have that? So you can pay $4, so we'll just say $4. So every generic is $4, and this is what the insurance is going to pay, right? So that's your copay. And so out of $12, right? Hold on, somebody do 1,000 divided by 12. What is that? How many? Do 30. Yeah, do that.
1,000 by 30?
Yeah. I want to see how much.
33.3?
Times 12.
$400.
400? So potentially I can make $400 out of this bottle. You guys understand that? You guys understand that? Do that times, let's say I have 10 bottles. Or do that, I have 100 bottles at CVS. How much is that? Like $40. So I'm gonna pay, CVS says, CVS says, I'm gonna buy Monroe brand. I'm gonna buy, how many, I said? 100. I'm gonna buy 100 bottles of 1,000 count, bottles of the generic, and I'm gonna get, roughly $40,000 on that. But I'm only gonna pay, divide this by, divide 100 by 5, what you get?
20.
I'm only gonna pay like $20 for it. So we upcharging every time, we making all kind of money. Okay? So the insurance says, hey, I'm gonna, for every 30 count, you can do it for $4. And we still making, out of this 12, we still making, roughly $8 on every script. So no matter what the reimbursement, you're just making all kind of money. And then you do that times how many drugs, how many generic drugs you do that. We just continue to do that. That's why CVS is, look at CVS, it's the fourth, largest, most money made, in the world because of stuff like that. So brand name, same thing. If we're buying Pringles, the brand, we may buy 1,000 count bottle at $30. $30. That just kills, it. Now your insurance still gonna pay some type of premium. We only make $2. We only make $2 on the brand name. So that just cuts our margin down. That's why generics are key. Question? That's the concept. That's it. Question?
Oh,
Yeah.
is it possible we can have this in next week?
No, Wednesday, I think it's. Because we have, hold on. Y'all have any questions about your business plan? That's coming up. Like y'all started? Y'all want to run something by me? Y'all good? Anybody? Y'all good with that? Any questions?